Good evening again, everyone, and welcome to our MES Masters segment. Tonight we're going to continue on with the session we did topic we had last session, and we talked about Mrs. Jacobs. She is a 79-year-old female referred for a left total hip replacement, okay? That left total hip replacement was done 4 months ago. It was a cemented anterior approach. So if the surgeon is actually doing this surgical procedure, he or she's going to come in this way, and they're going to actually cut these ligament structures so they can now access that hip joint. And this new femoral head is going to look something like this. There it is right there. There's our new femoral head. That's what our new acetabulum looks like, and it pops right in. And she has knee pain at the level of a 5. That knee pain is from that old arthroscopy back in '87 and the PFS as a result of never developing that quadricep enough. And we're going to ask her to bring her knee to her chest. And as she brings her knee to her chest, I'm going to readjust everything because I got to move. And guess what? Now the value that we see here on the goniometer should be her range of motion value. And what we're going to do is realign everything so that we're finding that lateral condyle there. And her range of motion there is, actually it was about 15 degrees. This is our MedX Pro network. If you haven't had a chance to look around in there since you joined the MES Masters, please do. Probably one of the biggest things is the professional resources that we've set up for you. There's one there that says goniometry. Click that goniometry one, and it's going to take you to the goniometry section, and it's got range of motion values for the cervical spine, the wrist, the ankle, the knee, the hip, and there's hip extension. There we go. It opens up, and it's going to play the hip extension video. It's got the step-by-step process here. Now, dermatome is an area of skin. Derma is a Latin word that means skin, tone means cut. So it's an area of skin that's innervated by a particular nerve. We also have myotomes. Myotomes are muscles that are innervated by a particular nerve. If you have one leg that's way up here, okay, and then the other leg is way down here, it's telling us that that hip capsule on that side is tight. Now, and what we should see here is that this leg is parallel to the floor or below. That tells us that our psoas is flexible. What we should also see here is that the knee here is at least 90 degrees. Relax your leg there for me. We want to see that knee at 90 degrees. This is telling us her rectus femoris is tight. Just keep progressing her and make sure that as we're training her, she's taking her blood pressure medication. As we strengthen her, congestive heart failure won't go away, but what we should see with the congestive heart failure is her endurance gradually improves. So here's your homework assignment. What I'd like for you to do is look at Mrs. Jacobs, a fictitious Mrs. Jacobs, okay? And what I'd like for you to do is develop the exercise program for Mrs. Jacobs for week 1, and then develop the exercise program for her in week 4, and then develop the exercise program for her in week 7. Okay, so 1, 4, 7. Showing the progression that you would do with her along the way. Now, she has no complications. She should do very well. She should be your bread and butter type of client. And when she gets to the point where she's fully functional, you can step her down to personal training and keep working with her, but you may not have to do all the stuff you do with medical exercise training. Thank you for joining us, and we'll see you in 2 weeks. Take care.